the videos, what I had taken up previously was on the hallucination and the types of it. So in this video, I'll be mainly focusing upon the other remaining types of hallucination, what was exactly left. So I have tried my level best to simplify what are those hallucinations. So in simple terms, what we can understand about hallucination, it is some kind of a false perception. So whenever there is any kind of a false perception or any kind of a sensation without the presence of any stimuli, it is called as hallucination. So in the previous video I have already talked about the visual hallucination, but in the succession to that video, the second type of hallucination, it is the auditory hallucination. So auditory hallucination, this is a kind of a false auditory perception. Means the patients or the individuals who are having auditory hallucinations, they might be hearing voices that are not actually present in the environment, and they hear false noises, they can hear false sounds, or they can even hear false voices which is actually not present in the surroundings. So these are auditory hallucinations, and such individuals are mostly they can hear the voices either, or they can hear certain kinds of a buzzing or a hissing sound. So these sounds can be of any sort, whether it be whistling, buzzing, hissing, any kinds of sounds they can hear. So most of the times it has been found that this kind of an auditory hallucination is mostly seen in schizophrenics. So the patients who are suffering from schizophrenia, or as well as the patients who are having bipolar disorder or dementia, they are having this kind of an auditory hallucination. So when it comes to auditory hallucination, such individuals, such persons, they are going to hear voices that are not actually present, and these voices can be either of three types. They can be either complementary, or they can be critical, or they can be neutral. So they can hear voices what are actually complimenting them all the time. So it is quite pleasant and it is quite acceptable for such patients to hear such complimentary noises or hear such complimentary voice. All right, but sometimes it happens, it is seen that certain auditory hallucinations can be critical or they can be neutral. In some of the cases, the voices what these individuals hear, they can also have a running commentary on the person's action. So you might have seen in certain kinds of movies and cinemas, you must have seen certain individuals where a person is having no one in the surrounding, and that person is having a running commentary on his or her individual actions. So the voices can also have a running commentary on the person's actions. Apart from this, command hallucinations can also be there. So in such cases, the individual who is being affected with this auditory hallucination can get certain commands from the surroundings, and he can hear such voices which is actually not present. So this is kind of a false perception of hearing certain voices can be there in the form of even commands. So most of the times it has been found that certain patients, the patients who are suffering from this auditory hallucinations, most of the times it is very much distressing for the patient, because constantly when certain kinds of these here, when the individual is hearing so many voices being constantly and repeatedly asking him to do something or having a certain commentary on that individual's actions, so it becomes quite unpleasant and it becomes quite distressing for the patient. So when such cases, it is mostly seen that the person is very much anxious. There occurs anxiety in such persons, but there are certain individuals where the running commentary or the voices what the individual is hearing, it can be the person may get used to it if the commentary or the voices what he or she is listening might be of certain kind of a neutral, or if it is a complementary type of voices what he is hearing. So such individuals of auditory hallucinations, they may sometimes get used to such voices. So actually they learn to live with such voices. So in most of the patients, they can also occur as a result of bereavement. So when it comes to bereavement, means they can hear the voices of their someone who actually loves them. So when due to certain reasons they lose a particular person in their life whom they actually love, so such patients, such individuals, they also say that they can hear the voices of whom they love. So this kind of a bereavement is also this kind of a the loss of a dear one whom they have lost. They can hear the voices of them being constantly, they can hear the voices of their loved ones. So such kind of an auditory hallucination can also occur in such individuals who have lost their a dear or a near one, and they feel, they believe that they can hear the voice of their loved ones. So this was all about the auditory hallucination. And when moving on to the olfactory hallucinations, now the next type, it is the olfactory hallucination. And this type of an olfactory hallucination means a certain kind of a false perception of a certain kind of orders. Means in the external environment there is not presence of any odor or smell, but these individuals who are having this auditory hallucination, they have a false perception of the smell what is in their surroundings. So this type of an olfactory hallucination can be a result of certain neurological manifestations, like neurological problems such as toxic substances if they are going to consume, or drugs. There are certain drugs, or in certain cases there can be traumatic brain injury, brain tumors, and viral infections. So this olfactory hallucination has been given another name, what is called as phantosmia. In the recent times, the very common example of this olfactory hallucination was found due to certain kind of, when it comes to viral infections during the COVID times. It was found just because since the individuals were COVID positive, the coronavirus had also some symptoms associated with phantosmia, where the individuals who were suffering from COVID, they could not have a feeling of the sense. Their senses were lost. The sense of smell were lost. So it is actually the olfactory hallucination what was seen due to a viral infection, where the sense of smell of such individuals were lost. But as soon as with time, these individuals, they recover from this COVID virus, slowly and gradually their sense of smell comes back to normal. So this kind of an olfactory hallucination may be due to certain kind of traumatic brain injury, brain tumors, or either it can be caused due to certain kind of viral infections as well. Now moving on to the last but not the second last, it is the gustatory hallucination. So gustatory hallucination means that the person is going to have a taste, a certain kind of a pleasant or an unpleasant taste without any external stimuli. Such individuals, they may also have certain kind of a sweet, salty, sour, or bitter taste without any external stimuli. And this is actually the gustatory hallucination, and it has been also referred to in another words, it has been called as phantogeusia. So phantogeusia, this has been mostly found in certain individuals who are suffering from certain kinds of neurological problems, and that too in patients who are suffering from epilepsy. So the epileptic individuals, they are having a certain kind of a metallic taste which they can experience what without any presence of an external stimuli. So this was all about the gustatory hallucination. Now the next and the most important one, it is the tactile hallucination. So tactile means the feeling of touch, the perception of touch. And since it is a hallucination, so there is a false perception of being touched. So such individuals, they feel that they are having certain kind of a touch sensations without any external stimuli, and these touch perceptions, they can be either in the form of, they can complain that there are certain kinds of bugs crawling over the skin, or the snakes what are crawling under the skin or over the skin. So this type of a tactile hallucination can also be seen in certain individuals, where they feel that there is a particular type of, in other scenarios they can also feel that there is a false perception that somebody is giving them a peck, somebody is kissing them, or certain kinds of a sexual activity, the sexual kind of sexual feelings of being touched. So the such kind of hallucinations, that is the tactile hallucinations, can be seen where there is, the person is not being touched, but still he can feel that he has got a perception, a false perception of touch. So most common, this type of a tactile hallucination, it is being most commonly associated with substance abuse. Those persons who are having consuming certain drugs such as cocaine or amphetamines. So due to drug abuse, substance abuse, this kind of a tactile hallucination can be experienced. Last but not the least, we'll talk about the general somatic hallucination. So general somatic, soma means body and somatic means related to the body. So in the general somatic hallucinations, what do we find? That such individuals who are being affected by this, their bodily perceptions, they have certain kind of bodily perceptions without any organic problems or any kind of disease. So these persons, they are going to experience throughout their body certain kinds of feelings that is actually not present, and in certain cases it has been found that these persons, they have a fear that they have been injured, they have been traumatized to such an extent that there is disembowelment, or they have certain kind of a feeling that their body is getting damaged or injured due to mutilation, and they have a false fear of it. So these persons experience that their body is being seriously hurt through mutilation or through disembowelment. Means such individuals, they can even report that they can find certain animals what are trying to get into their body, or they can also feel that there are certain animals or bugs that are crawling in in their stomach, or there are snakes what are crawling in their stomach. Example, the patients, they complain that there are animals what are trying to invade into their body, such as snakes, like, which are crawling into their stomach. So the difference between tactile and bodily or the general somatic hallucinations is that such individuals, in tactile hallucinations, that can be restricted to a particular body organ or a type, but in case of a general somatic hallucination, what do we find is the false perception is throughout the body and not localized to a particular organ. All right. So students and viewers, this was a very short discussion about hallucination. I have tried my level best to simplify the types of it. If you still have any queries or comments, you are most welcome to comment me in the comment section. And viewers and students who are new to my channel, who haven't subscribed yet, go do subscribe my channel, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.